Hi, my name is Terry Mamounas. I'm a breast surgical oncologist. I'm the director of the Comprehensive Breast Program at the Orlando Health Cancer Institute here in Orlando, Florida. So the question is, what is a tissue expander and what is its role in breast reconstruction? So a breast tissue expander, as we know, is an inflatable breast implant originally designed to stretch the skin and the pectoralis muscle post-mastectomy to make room for a future and more permanent implant. But with the implementation of skin sparing and nipple sparing mastectomies, which are now common, tissue expanders then were primarily used to stretch the pectoralis muscle for future implant insertion and were traditionally placed beneath the pectoralis muscle. But we don't need to stretch the skin more often now because we leave enough skin behind in our surgical approach. So more recently, though, pre-pectoral tissue expander insertion has been adopted, where the expander is placed on top of the pectoralis muscle. And in that case, it's primarily used to create a breast mount at the time of mastectomy and let the skin not be all wrinkly if you remove the whole breast, and use it as a placeholder for capsule formation and then future implant insertion or autologous reconstruction, whichever the patient and the surgeon prefer. So prepectoral insertion actually of tissue expanders has clinical advantages that includes less postoperative muscle spasm and pain that minimizes the requirement for narcotic pain medications. And along with what we have now routinely performed like PEC blocks, regional anesthesia blocks, they have made mastectomy plus the reconstruction actually an outpatient procedure in a large proportion of the patients. So we have made tremendous progress in converting mastectomy with reconstruction from really 1 or 2 days in the hospital procedure now to become an outpatient procedure, much more comfortable for the patient. And of course, another advantage of the prepectoral tissue expander placement and then ultimately prepectoral implant reconstruction is that it eliminates the animation deformity that we see with retropectoral expander and subsequently retropectoral implants. So typically, tissue expansion begins about 3 to 4 weeks after the mastectomy, depending on the need for adjuvant radiation and adjuvant systemic therapy. And essentially, saline is infused in the expander through a tiny valve mechanism that is located inside the expander, and it can be located from the skin with a magnet. So gradually, saline solution used to fill and expand the expander to the desired implant size. And at that point, usually a few months down the road, then a nice capsule is formed around the expander, and then the expander is removed and further reconstruction proceeds either with the implant reconstruction or autologous tissue reconstruction, depending on patient wishes.